watching the award-winning GHS-TV, a nationally recognized student television station.
Hello, this is Medical Talk with Betty LaMarr. Joining me is Dr. Shazia M. Hussain, pediatrician. Our topic today is the tripledemic. We're talking COVID, RSV, and flu. Thank you, Dr. Hussain, for joining me today. The last time you was with me, we was dealing with the COVID pandemic, and I had you with me remote. So it's so good to have you here in person. Let's get started. For our viewers that may not know Dr. Hussain, tell our viewers who you are and what you do.
So I am Shazia Hussain. I'm a pediatrician. I trained at LaMarr too many moons ago. So I've been in practice almost 30 years. And currently I am working with Pediatrics East that I've been with for the last 22 years. And we are, I'm at the Germantown location.
Okay,
So.
perfect. Now, you know, of course, in the past, it was all about COVID. So it seems like it's all respiratory these days.
Yes.
So now we have this tripledemic. But I want you to get us started with whatever you want to get started with here. And then, of course, we're going to flow into the tripledemic. Tell us right now. So where are we?
So, you know, these are very interesting times. Probably something we will always remember all our life, you know, once in a lifetime thing. So the COVID-19 started obviously December 2019, and we went into lockdown in March of 2020. And very interestingly, the lockdown and then the social distancing and working from home and virtual school, all of that caused all the respiratory illnesses to go in hiding. We were not transmitting infections, and even the children of the essential workers that were in daycares were not getting sick. We had COVID and everybody was, you know, deathly scared of dying from it. And the truth is we've had about 100 million cases of COVID in the United States, and we have had over 1 million deaths. You know, when the COVID first came out, there was talk that maybe 2 to 5 million people would die, and people above 50 were really scared for their life, and those above 75, the grandparents, if you remember, we talked about let's keep grandparents safe.
Yes.
They were the ones that were at very high risk. So then, so all of 2020, we kind of stayed away from each other. And then the vaccine came out in 2021, and people started mingling a little, but still a lot of people were working from home, and there was school from home, and there was still masking. In 2022, the masking went away. People started mingling. A lot of people were vaccinated. We had vaccine for children. And lo and behold, the infections were back, and they are back with a vengeance.
Okay.
You know, it's like the beast that has been unleashed.
Okay.
All pediatricians that are currently practicing have probably had the busiest year of their career last year because the respiratory infections have been insane. We had, you know, the Alpha wave and the Delta wave and the Omicron, and last year, the January, February was crazy Omicron. Then in the summer, we had another Omicron phase. But then last fall, September, October, November, flu just exploded. Last summer and all of last fall, and currently, of course, RSV has also been crazy. So just to give you an idea, normally in the United States, we have 38 million to 50 million cases of flu in a year. In the winter of 2020, 2021, there was only about 5,000 cases of flu in the United States versus 38 million minimum. And that is insane. So flu was completely missing in action.
Right.
And then last fall, we have had one of the worst flu seasons ever. I would think we were seeing insane numbers of flu. And you know, in our practice, we do a COVID flu PCR test. And so all through the pandemic, we got the test in November 2020. All through the pandemic, we've been doing the COVID test, along with it, the flu test, because our test does both together.
Okay.
And we did not really see any even silent flu cases at all, hardly, till we started seeing flu in the summer of 2022. Wow. And the beast was unleashed in the fall. So that is the tripledemic or triple epidemic that we are seeing currently of flu, COVID, and RSV. COVID, interestingly, went away for a little bit. Went away as in, you know, there was only 13,000 to 15,000 cases in the US that were reported a day. And now we are back up to 50 to 60,000. So COVID is coming up, where flu has kind of calmed down. For the last 4 weeks, the number of flu cases have been going down. RSV has kind of been there since the summer all the way and still.
Okay, so let me ask you a quick question before we end this segment while I'm thinking about it. So when we were really battling with COVID, is it that some people may have had COVID, thought they had the flu, or they had the flu and they thought they had COVID, for the ones who didn't go get checked? For what reason did the flu sort of go away when COVID came on the scene?
So I think what happened was, you know, flu or all of our respiratory illnesses, I explained to the patients that are asking me, why is my child getting sick right now? That spread of infections is like a chain reaction. By working from home, social distancing, masking, school from home, a lot of those links in that chain were missing.
Okay.
So the infections were not going down the chain reaction.
Okay.
When we started mingling again and taking off the mask, all those links started coming back in place.
Now, we're going to stop right there and we're going to come back to that, because that is so very important. We're going to take a quick break and we're going to pick up right there, because I can't wait to see how this happens. Watch this space for more Medical Talk.
The orchestra program at Germantown High School is now in its 7th year.
An orchestra, I guess, physically is composed of a lot of different people. Sometimes you'll have chamber orchestras that are maybe only 4 people, and then other times you'll have a 100-piece orchestra. But ours is kind of an in-between. It's maybe like 20 or so, I'd say. But it still takes every player to understand how to perform a piece.
We now have 2 groups, 2 distinct classes, one of an intermediate level and one that's quite advanced, and they play music that is at the level of almost any other high school in the area.
I think Germantown High School's arts program wouldn't be the same without the orchestra, because without it we lose a more classical sound. We lose that kind of warm wooden sound. And not only that, but we lose some fun people that are in the orchestra program.
They're practicing, they're listening to each other, they're cooperating, they're all working toward a similar goal.
It's very fun and exciting, especially when playing in concerts. That level of competition almost, it's just invigorating.
They're able to enhance their own love for playing, for ensemble, for performing. So I believe that certainly if they stick with it, they will really love what they're doing.
For more information about the Kappa program, visit ghskappa.com or call 755-7775.
You're watching the award-winning GHS-TV, a nationally recognized student television station.
Thanks for watching Medical Talk. We're talking about RSV, flu, and COVID with Dr. Shazia M. Hussain. Okay, now, Dr. Hussain, I'm learning a lot. That's one thing I love about Medical Talk. It's really like getting free healthcare, right? You know, because if you listen, you learn.
Yes.
So let's go back to, okay, if I have a sniffle, like right now I have an allergy, and if someone was around me with the allergy, I'd probably be like, oh, I'm not sure. Let me make sure my mask is tight. So how do we know the difference between COVID, the flu? Since we started there, we're going to get into RSV in a little while.
So, you know, interestingly, these three being respiratory illnesses, it is difficult to know for the layperson, but there are things that we can learn today. For instance, flu hits hard. Oh. And it will give you, you know, like that, you will be hit with high fever, body aches.
So it's almost immediate.
It is.
Okay.
It is. Generally speaking, flu presents itself completely within the first 24, 48 hours.
Okay.
How bad you're going to feel, you pretty much feel within the first 2-3 days.
Okay.
And so that is, it hits hard with high fever, achiness, sore throat, and the cough with flu can be relentless. And a lot of times your eyes, you know, there's a glassy look in the eyes. Nowadays we are blessed with all these tests, but I have practiced for so long that we used to look at the child during the flu season and kind of say, okay, this is flu. You had to sharpen your clinical skills. Now you can go in and see the patient, and because there is tests available, it's a lot easier. So there is no home test for flu. That being said, if you think your child has flu, you want to go see the doctor. Okay. And the good news is you want to go within the first 48 hours because there is medications available for flu. Okay. There's Tamiflu, and then there is the new medicine, Xofluza. Those are the two we are using mostly. This past season, we've had a flu A epidemic, and flu B usually comes a little bit later in February, March end. So, but Tamiflu and Xofluza work against both strains of flu.
Okay.
The COVID has changed. You know, in the beginning, if you remember, people were getting fever. If you know, we were testing for COVID. There was certain criteria we were using to test for COVID. If you had been exposed to somebody with COVID, you had fever, and you had a cough, we were almost certainly testing you for COVID. Now Omicron and this change in COVID has made the COVID a milder illness, fortunately.
Okay.
And also, of course, we are so fortunate in today's day and age that medical advances have happened, and there is medicine for treatment of COVID in the high-risk children. We do that, and of course, adults can go get their medicine. But fortunately, again, COVID has translated to a milder illness. We do have the home test for COVID, which is priceless right now. And generally we tell the parents, you can do the test, but keep doing it maybe every day.
Okay.
Till your 5 days of expected incubation are if you're asymptomatic or you don't have any test positive, and it may be some other virus.
So, and what I'm hearing, I think, is with the flu, for those who need to know, the flu hits hard and heavy.
Yes.
Whereas COVID, you may have it, but it may take a little time before it
presents itself. And COVID, because it's milder now, you know, it's sore throat, little fever, and not as much cough. And interestingly, you know, you can have headache, or it's become more of an upper respiratory rather than a lower respiratory infection, which was
is
killing
good for
people.
the lungs,
yes,
right? Okay.
Yes.
Okay.
Then lastly for RSV, you know, and I want to talk a little bit about that too, is in younger children. It's a bigger problem under 2. Older folks, we can get RSV too, but RSV is milder, like a cold in us. It's the younger children, and RSV, the younger kids that get the RSV will start with a little sniffle and, you know, they like a little cold, but 4th, 5th, 6th day is when they actually start wheezing and it goes in the chest. So RSV in the littler kids is a lower respiratory infection. And the kids under 6 months are at a higher risk.
Okay, question. I have a friend that works at a children's hospital.
Yes.
And she says that children come in sometime in the ER, and she said it scares her to death because it's like almost like every breath that they take is their last. Like they can't. And is that RSV?
So the kids that are at higher risk for serious RSV, of course, are preterm kids, premature children. Anybody with respiratory or congenital heart disease, you know, they are going to be at high risk for RSV. And unfortunately, 50% of children who do get admitted with RSV may be actually normal kids, but RSV has hit them hard.
Okay.
But they are generally speaking younger than 2, and more so younger than 6 months of age.
Okay, now, before we go, learning so much, Dr. Hussain. So before we go into this next break, when we come back, rather, I want to go more into RSV because I have so many questions about that. Where does it come from? Does it come from the adults to the children? So we're going to get into that in our 3rd segment. And then I want you to break down all 3 to our viewers so they'll know exactly what they're dealing with before they rush to and when should they go to the ER?
Yes.
Don't go anywhere. We'll be right back with Dr. Shazia Hussain. We're talking about COVID, RSV, and the flu.
I think that the visual arts really help students to develop a new vocabulary.
There's a lot of different ways that you can do art, so it's just multimedia way of communicating, expressing yourself to other people.
At Germantown High School, we offer our introductory classes, which would be our Art 1 classes, Art 1 honors, and then you would move up into Art 2, Art 2 honors, and you can go towards the IB path, which would be what I teach, the International Baccalaureate art classes, and we also have AP art classes.
That's when you start being able to practice your skills on your own, so the skills that you learned freshman year, you get to start to kind of put them into practice and have a little bit more creative freedom.
At Germantown, we have, of course, all of the basic media, drawing, painting, all of that. But we can do a lot of printmaking. I do some fiber arts in my class, so we do, fiber design, fabric dyeing. We also have some sculptural media and processes that we explore through found object sculptures, some clay.
Even though I'm only a senior in high school, I feel like I'm a very sophisticated artist and ready to further that.
At some point in school, you're gonna have something that's gonna have to do with art. You're gonna have to make a poster, this, that, and the third, and you're gonna have these skills because you've taken this art class. You're gonna have new relationships with teachers that you might need later. Like, it's just a big learning experience.
For more information about the Kappa program, visit GHS-Kappa.com or call 755-7775.
You're watching the award-winning GHS-TV, a nationally recognized student television station.
Welcome back to Medical Talk. I'm Betty LaMarr. Joining me is the renowned pediatrician, Dr. Shazia Hussain. Okay, Dr. Hussain, here we go. Now, we into RSV. I want you to take this last segment and I want you to just educate us on everything that we need to know about RSV, flu, COVID, vaccines, whatever we need to know.
So real quick, I talked about flu and it hits hard and you want to go to the doctor because when you have fever, cough, body aches, you want to go quickly so you can get treatment if you choose to. And if you don't treat it, majority of the people will get over the flu too. COVID, we have the home tests. Generally speaking, in children, we don't give medication unless you are a high-risk individual, a baby with underlying illnesses.
Okay.
And so it is a milder illness, sore throat, headache, fever, and body aches, then they get over it pretty quickly.
Okay.
The RSV is in littler children under 6 years, and especially under 6 months of age, can be an illness that can get them really, really sick, especially the ones that have underlying illnesses like asthma or are premature.
Okay.
And the recognizing factors for RSV, serious RSV, is respiratory difficulty, where they're breathing hard. They may have had a little cold. Suddenly they start coughing really bad, coughing all night, and then they start breathing hard, don't want to eat, they're irritable, they're getting really sick. You want to go to the pediatrician right away, or you want to go to the children's hospital, depending on how sick your child is.
Okay.
And so RSV, definitely currently of the three illnesses, in little children can be the biggest scary illness for parents. Having said that, we have prevention for COVID with the COVID vaccine. We have it in all ages in children 6 months to 18 years. And the vaccine is, as all vaccines are meant to save lives. They don't mean that you're never going to catch the illness. What they mean is they will prevent serious illness that will prevent you from ending up in the hospital. So if you take the COVID vaccine, you may still get COVID, but you won't get a serious version of the disease. Good. Flu shots have always been there. Take your flu shot by October. Flu is a serious illness in the little kids, again under 2, our high-risk population of normal children, but under, younger kids under 2, or any child with asthma, heart disease, or any other immunocompromising illnesses. There is flu shot available. Again, the flu shot prevents serious flu. It prevents you from getting hospitalized with the flu. Finally, good news, they are working on RSV vaccine.
Yes.
For the first time, there's going to be, they've been studying this vaccine in mothers. They give it to the mother. That protects the child, the infant newborn for infant for up to 6 months. And these are studies that are being done currently. And so what I read this morning was there are 2 other vaccines too that they are going to give to infants. So there is hope for RSV. Now there is, they give preventative medication to little premature babies through October through March. It's called Synagis. And the parents that have children that are eligible for Synagis are told about that up front.
Okay.
So that's also a factor. Last thing, I do want to give this message about vaccination.
Yes.
The infectious disease doctors teach the pediatricians that the immune system is like an ocean. A cold, a mild flu is like 1,000 drops in the ocean in terms of stress. Your vaccines are 1 drop in the ocean each. So don't be scared of vaccines.
Yeah.
Vaccines save lives. That's what and this triple epidemic, we don't know how long we are going to have this surge of infections, but I'm hoping that, we will get back into the rhythm of normalcy.
Yeah, me too. I was hoping this year we would be there. Okay, so as a pediatrician, do you have more or less patients that are receiving the vaccine, the COVID?
I think it unfortunately has been so politicized.
Yes.
But majority of the patients, they trust their pediatrician. And if the pediatrician recommends it, my patients are, which I do recommend it, because I do believe in vaccines.
Yes, me too.
And so they will, most patients are willing to take the vaccine if their pediatrician recommends it, so yes.
Well, I believe in vaccines because I tell people all the time, when I grew up, my mother, we used to have a little mobile clinic that came into the neighborhood. And I grew up always getting vaccines. My mother believed in us getting our vaccines. And then when I joined the military, oh my God, I mean, you had no choice. I used to tell people, you walk down this long line and somebody would hit you over here with a little, look like a little gun. They'll pop you over here, and by the time you go out, you look on the side, somebody just, so all the way down the line, you don't know what you got, but you trust that whatever the military, whatever vaccine was to keep you healthy and to keep you well. And that's how I approach life. So I have all of my boosters. As soon as the VA notifies we need a booster, I need pneumonia. What's that real bad, that older people get, I call it older people.
Shingles.
Shingles, tetanus, anything that they tell me I need, I'm in line. Because I believe in, and it's important for me, being healthy.
Yes.
And being well.
Yes.
And I don't want to be sick, Dr. Hussain, because I didn't do what I need to do to take care of me. And I appreciate you so much for being on the show with me today.
Absolutely.
You've given our viewers, as well as me, a wealth of information. And I thank you.
Thank you. I'm glad to be here and glad to be of help.
Thank you so much.
Sure.
Thanks for watching Medical Talk on GHS-TV. I would like to thank my special guest, Dr. Shazia M. Hussain, for joining me today to give us the tools we need to navigate through the tripledemic, COVID, RSV, the flu. Remember, you can also watch us on Fridays at 9:30 p.m. on Comcast Channel 17. For more information on our programming, please check us out on the web at GHS-TV.org. We're streaming live 24 hours a day. You can also check us out on Facebook and Twitter. I'm Betty LaMarr from all of us at GHS-TV. Thank you for watching Medical Talk, and we hope to see you again.